Hello, in this video, I'll be answering frequently asked questions about PROTONIX. If you find this video helpful, don't forget to like and subscribe to support my channel. What is PROTONIX? Its drug class and active ingredient. PROTONIX belongs to a class of drugs called proton pump inhibitors, PPIs. Its active ingredient is pantoprazole. Pantoprazole works by reducing excessive stomach acid production, making it effective in treating various gastrointestinal conditions. What is PROTONIX used for? PROTONIX is used for the following conditions. PROTONIX is commonly prescribed for gastroesophageal reflux disease, stomach and duodenal ulcers, Zollinger-Ellison syndrome and other conditions causing excessive stomach acid production, treating Helicobacter pylori-associated ulcers in combination with antibiotics. How to take PROTONIX? PROTONIX is typically taken once a day and usually starts to show effects within 2 to 3 days. However, the treatment duration may vary based on the individual and should follow the doctor's recommendations. The duration of effect may differ for each person, but long-term use helps reduce stomach acid. PROTONIX tablets should be taken before meals. Swallow the tablets whole with water. Do not chew or crush them. To maintain consistency, it is recommended to take it at the same time every day. If you miss a dose, take it as soon as you remember. However, if your next dose is approaching, skip the missed dose and take the next one at the scheduled time. Do not take a double dose. Prolonged use may lead to certain side effects. Therefore, it should be used under the guidance of a doctor and with regular checkups. Warnings and precautions. Inform your doctor if you are allergic to pantoprazole or other PPIs before starting PROTONIX. If you're pregnant, breastfeeding, or have liver disease, consult your doctor. Long-term use of PROTONIX may lead to issues such as vitamin B12 deficiency. PROTONIX can interact with certain medications such as blood thinners like warfarin, antifungal medications like ketoconazole. Therefore, inform your doctor about any other medications you're taking. PROTONIX reduces stomach acid, which may lead to stomach discomfort. If you experience any pain, nausea, or vomiting, consult your doctor. Possible side effects. PROTONIX is generally well tolerated, but some side effects may occur. Common side effects: headache, abdominal pain, diarrhea, nausea. Less common: skin rash, muscle pain, fatigue. Severe reactions: allergic reactions or liver problems. If you experience any serious symptoms, contact your doctor immediately. That's all the information I have to share about PROTONIX. If you have any further questions, feel free to ask in the comment section. Stay healthy, and I'll see you in the next video.